Hey everyone, welcome back to my channel. So I didn't do a week 2 update because I was exhausted and I was tired, and honestly I did not even have the energy to do it. So this week's video is just going to be a recap on week 2 and this week, which is week 3. So I'll start with week 2. So last week so I talked about in the first week how it was really great and everything was going really well. Second week, it's definitely going well and everything, but now, you know, we're supposed to have our basis down. We're supposed to know how to, work the EMR and all that stuff. So the basics have were put in place, so now it's really honing in into seeing patients. So I can't even remember. I think I saw maybe 5 or 6 patients throughout the 2 days that I was there, and I finally experienced my first new patient to establish care. So that was the first time when you're really doing a full H&P, and it takes quite a long time, but I had a very interesting experience because I had to use kind of like a translator in order to get the information. So I'm glad I had the experience because I mean, getting a full H&P, it takes a long time, but now with the translator into it, it takes kind of twice as long. But it was definitely interesting to see how that would work out, see kind of the expression of the patient and including their translator in, with the whole aspect of care. So that was very interesting. It was definitely very overwhelming because I had never done a full H&P individual before. Most of the patients that I've seen so far have been like follow-ups for medication refills or follow-ups for blood sugar levels or things like that, but nothing for a full H&P. So I definitely had to go in back and forth a couple times because I wasn't getting all the information that I needed. So one thing that was suggested to me is to write, put on a sticky note old carts and the order of the H&P on like 2 sticky notes and stick it on your computer, like on the sides, or if you want to even just put a sticky note on the computer, like from the computer, to just have that order in place so that you're not forgetting things and you're not forgetting information to ask, because that I think is also what slowed me down, because starting from the beginning I'm very slow with learning things. So with that plus all the questions and the translator, everything, it was just kind of like a very overwhelming process. But now that I understand better the order and exactly what they're looking for, the types of questions to ask, especially for a new patient, because you obviously want to make sure that you're not missing a diagnosis, or you just really want to make sure you get the full, patient health underway. So that was really helpful and I started doing that afterwards, and now when I go in and speak with patients, it's way more fluid. It's not me going in back and forth because I keep forgetting to ask certain questions because they have it right there for me. So as long as I follow that, there might be certain little details here or there that you miss or you don't think to ask, because we are still learning, of course. But in the beginning, it's definitely nice to have some sort of basis underway. So if you want to try that, I think that's a great thing. So last week, I don't think there was really anything too, I guess, remarkable except for that new patient, because that was really interesting to see. I did have one patient that they had, I think, hypertension, and then it translated to chronic kidney disease stage 3. So it was definitely very interesting to see kind of like the comorbidities and how obviously one situation can start to affect other situations, and to see how they take part in their care and everything like that. So, of course, if you're in the healthcare field, you know that there's certain patients that, really take part in their care and they really do what they're supposed to do, and then others that, they feel okay, so they don't think that they need to, help themselves because they just feel okay. So it's really important that I have learned to really educate someone who has multiple comorbidities, that even if they feel okay, that they still need to be healthy. They still need to take their medicine as prescribed. You know, a lot of times with different medications, you feel better and then they stop taking it because you feel better, but that's not the case. You have to see it through. You have to keep going, because if not, it's just going to get back to the way it was, even if you physically feel fine. So I was just learning a lot about life and about patience and, you know, how to approach things, because obviously every single patient is different. Their care is different. You know, if they can take care of themselves, whether they have insurance or not insurance, or they self-pay, the knowledge that they have about their comorbidities or about their conditions, whether or not they care to do anything about it, or they're just coming in to satisfy an insurance requirement. You know, there's so many different excuse me, things that are not necessarily health related, but they are part of their care, and it's definitely very important to know. And I feel like I'm getting a lot of quick knowledge about it, because for me, when I don't learn, like if someone were to tell me something, I don't automatically know at that moment. I need time to, you know, write it down, really understand and digest it. But when you're in your clinical, especially if you're outpatient, you're seeing probably the same types of patients over and over. Like throughout the months that you're there, you're probably going to see some patients multiple times, just because of the nature of their care and how they need to come in and everything. So you start learning about them and their condition, and then it gets easier that way. But when you first start out and every single patient is new to you, you know, not new to the practice, but new to you, then it's a whole other thing that, excuse me, that you need to learn. It's not only learning about conditions and how to diagnose them and how to treat them and how to follow up, but it's also learning about the patient themselves and how their diagnosis affects them. So it's like right now, it's like you're kind of learning the diagnosis and the whole process, but then you have to kind of tie it into how that is related to your particular patient that you're going to see over and over and over again. So it was definitely a really nice week too. It was definitely a little bit more rough because, you know, getting into clinical and I have to drive kind of far to get there. It's totally worth it, but you know, it takes a toll after a while. And you know, the first day you're like, oh, ready, pepped, I'm ready to go. But then after a while, it's just kind of like, all right, I need to figure a way to really get through this. It's a lot of coffee, a lot of self-motivation and everything like that. So week 2 was pretty cool. It was chill. Definitely overwhelmed still. There's a lot to learn in a short amount of time. There's a lot of information out there, obviously. It's not a matter of just what you're learning in school, but what you're learning in clinical, and kind of tying it together and making sense of it all and making a list of how you're going to approach your care. It's just a lot at once. So just don't beat yourself up about it, because I definitely did that. I'm like, oh my gosh, like this is a lot. Like you get overwhelmed and it's scary and it's just a lot. But just take it day by day, do the best you can, and you know, you're not, I feel like sometimes, even for me too, you feel like you're competing with others in school, or you're competing with others in clinical, but you really need to don't worry about that, and worry about yourself. And I need to tell this to myself too. Worry about yourself to improve each time. Learn something new each time. You know, you keep learning things new, and then the bases that you've built before are going to keep improving. So that's not going to be an issue. Like, you know, when I first started, I need to learn how to use that particular EMR, how to order labs, how to order medications. And that was overwhelming because I didn't know any of it. Now that I know how to work that, that's already second nature, if you will, and I can keep learning new things. And then when you learn that, then you have to learn new things, and that thing is second nature. So take your time. Don't beat yourself up about it. This is a learning process, and I think I've said this before, even when you're in school, when you're not in school, everyone says that you're practicing medicine. Nobody's ever going to be a huge mastermind of medicine, you know what I mean? You're always practicing. This is my practice, you know, because you're never going to be knowing every single thing. I mean, there's people that know a lot and they're really good at their craft, but nobody's perfect and no one's going to know everything. That's why you're practicing medicine. So don't beat yourself about it. Just take it day by day, and you know, just keep learning. Just be open-minded, keep learning. Try to make every day a refreshed day. Don't try to like feel bad from the day before or anything like that. Just, learn what you have to learn, write everything down that you have to write, and have a new and refreshed day. So that was week 2. So on to week 3, which is this week. This was, I go twice. The first day was rough. It was a lot of information coming at me. My notes were not up to par. It was just a really big learning curve for me. It's like I understood how the note should be, but not to the extent of what was expected. So they actually were able to critique each other's notes, which it's super embarrassing for me, but now looking back at it, it was so worth it, because now I understand what they're looking for. I understand what a good note is, that's efficient, that's giving the information that's needed, but that's not so wordy, or it's not giving information that really isn't making any type of sense. So just for an example like that, instead of saying, let's say the patient had pain or whatever, instead of saying patient had pain, patient's pain was this, patient's pain was that, it's like, okay, we already know we're dealing with the patient, we already know we're dealing with pain, so now just describe, the onset, the severity, the timing, characteristics. Like, you can go head on with that without saying the patient or the pain over and over and over again. There's also ways to keep it more organized when you're talking about different problems in a patient. Like, don't just write one whole long thing. Like, give each problem their own paragraph or situation. So it's things like that that I've learned that I just didn't think of it, because again, like I think I said last time, you don't know what you don't know. So I'm really glad that happened, because the next day I had a patient that had a couple things that we had to go over. It wasn't just like a straightforward thing, but because it was critiqued all of our notes the day before, I really understood, okay, that's what you're looking for, that's what a good note is. And so following that from the day before, my notes improved dramatically. And it was great for me to know, it was great for my preceptor to know that the critiquing was helpful, and it really helped me figure out how to write a good note, because I had noticed before, if people are here for a follow-up, they'll say, I'm here for a follow-up for medication refill, or I'm here for a follow-up for a urine drug screening or whatever, but I never knew why they were taking the medication in the first place, because I'm new to the practice, obviously, and some people have been doing the same thing for years upon years upon years, and it's just a routine that they have, and they know that they have to come in every month and everything. But I don't know originally why you're taking this medication or why you're getting this urine drug screening. So it's really important it really shows how important it is to write a good note, so that someone that's new that comes onto the scene is able to understand why you're receiving that care. Because if I was with that patient years ago when we first started, then obviously I know why they need to be here. But then if you bring on a student, or you bring on another provider or anything like that, and it says, okay, well, I see that you're on this controlled substance, but why? Go back to the original origin of why they're even taking the medicine in the first place. So that was something that it really stuck with me, and it showed me how important really a good note is, so that when I go back and I see that you're here for a medication refill, I know exactly why you're taking it, I know when it started, I know how this medication is helping or is it not helping, stuff like that. It's extremely important to know, but it didn't really dawn on to me how important it was until I was looking at charts, and I'm like, okay, well, I don't understand why this person is on it, because they started years ago with this regimen. So it's just a matter of me going into the patient saying, hey, I'm a student, I'm new, could you tell me why you're on this medication? And then once you know why you're on the medication, then you can start asking questions about their symptoms. Are they doing okay? Is it helping? Is it not? And then kind of go from there. So every week I learn something new. an overwhelming process, because just being a provider at the provider level it's scary. I mean, I don't care how young you are, how old you are, how much experience you have. It's a scary thing because you know, you're dealing with lives and you don't want to mess up, you don't want to overlook anything or you know, miss something important. But this is the learning curve. We're always learning new things and you gain a lot of information. One thing that I recommend is, for us, we do obviously see patients, but we also learn and listen to lectures in between patients. And what I like to do is just, I have one, you know, note on my computer, and I just write down all that I can, and then later on in the day, if I'm not exhausted, I'll, you know, kind of organize it a little bit better and make more sense of whatever chicken scratch, you know, notes that I have, and kind of put it in just one place. And I think later on I plan to, because we do different things every day, there's no particular order, but we just are always learning, which I like, which is really good and it's helpful, that I'll probably organize my notes into body systems, so that everything that we learned about headaches you put in the HENT, or you know, that type of thing, because there's no particular order. So that's what I plan to do later on in order to be more organized, because that'll help me most likely study for the boards at some point. But I want to have those notes because, I mean, you learn a lot in school and you learn a lot through your textbook, but the real testament is when you're in clinical. That's when you learn hands-on. That's when you start remembering things a lot better. I know for me personally, I would say out of all the classes, pharmacology is probably the weakest, and based on the other students, they have said that pharmacology has been the weakest in really understanding in NP school. So that's something that we need to work harder on. But when you are seeing patients and you're seeing the medications they're on, you start to remember it better because you're able to apply that to a person versus, you know, reading it on a textbook and their bizarre names and you're just like, oh my god, I don't understand. But if you can apply that to a patient, be like, oh yeah, they had these symptoms and they had this condition and then they were on this medication, and it's easier to refer to. So when you hear it again, you know, okay, yeah, I know that patient had the same thing, and you know, whatever. So it was a great, this week I think was better. The second day was a lot better than my first, because it was just like a whole like 180 of improvement. And I just want to make sure that I keep improving each week, because that's important to me, and obviously in my career, and to learn. So thank you guys so much for listening. I really hope that me talking about each week, like how my clinical is going, is helpful. Just, there's not going to be always good days, but there's not always going to be bad days. So far I've been 3 weeks in and I've had more good days than bad. Only really one day was very overwhelming and stressful, and you know, just kind of like, whoa, this, like, what am I doing here? But I think I've said this before, I don't remember at this point, that, you know, whatever you want to do in life, don't let the bad days make you give up or make you think that this is not what you're supposed to do. You're going to have a bad day, no matter if you are at the most perfect job for you, no matter if you're at the most perfect school for you or the most perfect major. There are going to be bad days, and that's totally okay. It's something that I have to remind myself too, because I'm like, oh my god, this is just too much. Like, it's just too much. And it's just a day. It's just a bad day. It's not a bad career. It's not a bad schooling. It's not a bad, you know, path. It's just a day. So just try to tell that to yourself. I have to do the same thing to myself too. Obviously, I think for most people it's hard to take your own advice with anything, but just know that you just got to keep going. Don't give up. It's going to be okay. It's going to be stressful, but then you're going to have some bad moments like I did this week, the first day, and then you're going to have some great moments, which happened the second day, and when I felt like I was on top of the world. You know what I mean? So it's just going to come and go, but you'll be fine. Just keep going, keep learning, keep being open-minded, keep having each day being a refreshed new day to learn, get more information. You're learning things whether you realize it or not, because when you go back and talk about it, you know it in your head. Oh, I know exactly what you're talking about. So just take your time, don't beat yourself up about it, and it's going to all be okay. So again, thank you guys so much for watching. If there's any other video that's nursing school related or FNP school related that you'd like me to discuss, feel free to leave a comment down below. If you have any more personal questions about your own nursing journey, you don't have to leave a comment. You can just email me. It's in the description. box just if you have any questions or anything like that. I'm always happy to help when I can. I hope you guys have a wonderful, wonderful day. Remember to always believe in yourself, and I'll see you guys in the next one. Okay, bye.